And is this what's known as the heaviness of smoking index?
Yes.
And is this a way to determine the level of nicotine addiction?
Yes, the strength of nicotine addiction. So this is used in addicted smokers. So those who are persistent daily users, then we score them based on how much they smoke per day, time to first cigarette. You can see the scoring system there. It ranges from 0 up to 6. Those who score in the 5 to 6 category, when you add the two questions together, like if you're within 5 minutes and get a 3 and you're 31 or more cigarettes per day, you would get a 6. So if you score 5 or 6, we consider that highly dependent. If you're 3 to 4, you're moderately dependent, and if you're 0 to 2, you're mildly dependent.
Okay, and so somebody, if you go through all your criteria, you say, hey, I think they're addicted, but they're smoking, 10 cigarettes a day, they're smoking after an hour of waking. Is that something you say has a low level of dependence?
Yes.
All right. And so I want to go through the criteria one by one. You talk about persistent daily use, correct?
Yes.
Do some people smoke? What is a chipper, by the way?
A chipper is somebody who smokes occasionally on a someday basis, is what I consider a chipper. So somebody who's not smoking every day, day in and day out.
And what percentage of regular smokers do smoke every single day?
It's about 85 to 90%, depending on how you qualify it, because when you do point-in-time surveys, some people are actually daily smokers who are cutting back and they're trying to quit smoking, so they may be on a someday basis. But when you look at persistent non-daily smoking, it's about 10 to 15% of the smoking population, 85 to 90%, depending on the survey today, would be daily smokers.
And so why is that important in determining whether somebody is an addict?
Well, it relates to their struggles, their ability to stop smoking. So non-daily smokers tend to be able to quit more easily than those who are persistent daily smokers. Persistent daily smokers who have a higher dependence, a stronger dependence, like they smoke a lot per day, time to first cigarette, smoking right away, they're going to need more treatment. So relapse is more common in those who make quit attempts. And it tells that for a treater, for those who are trying to develop treatment plans, it's the way we screen patients to determine a treatment plan for the smokers. For highly dependent smokers, we're not starting with standard treatment. We actually go, they'll use the patch and lozenge together, or, we'll utilize multiple forms of treatment because we know that their relapse likelihood is much higher.
When did the patch first become available by prescription?
1992, December of 1992, I believe.
What about lozenges? When did they first become available?
Lozenge wasn't invented until the late 90s, I think 1997.
And what about drugs like Chantix and Wellbutrin? When did they start being prescribed as a treatment on label for nicotine addiction?
Well, Zyban, which is the drug Wellbutrin, for smoking cessation, was introduced as a prescription drug in 1997, and Chantix or varenicline was introduced as a stop smoking prescription drug in 2006.
Are those good medications that can help people today quit smoking?
They're the best therapies that we have. I wouldn't say they're great. We're still looking for better treatments to help people quit, but Chantix is probably our best treatment today. It tends to outperform the patch or Zyban, for example.
And so based upon your review of the record, how many years did Floyd Olson smoke for? How long was he a persistent daily user of nicotine?
Well, the evidence is that he was smoking, according to medical records, from the age 12 until the time, essentially, he was diagnosed with lung cancer and continued to smoke after he had lung cancer. So right almost up until the time he died. So that's over 40 years. So that's a long, persistent duration of regular smoking.
And we get to when he got lung cancer, without getting into the details, we'll talk about it more. Did he ultimately try to quit at that point in time?
He did. According to the evidence that I reviewed, he tried to quit and was maybe off for a day or two and then relapsed back to smoking.
And so we'll talk about that in a moment. But in terms of the definition that we showed, chronic compulsive use, did Floyd Olson exhibit chronic compulsive use of a drug for many decades?
Yes.